Cognitive behavioral therapy is the most common type of treatment for depression and the highest evidence-based treatment for depression. It's a broad area, but I'm going to show you a few examples. This is a CBT thought wheel, a common CBT exercise. The general idea is what you think leads to what you do, leads to how you feel. So for this exercise, thinking positively might lead you to exercise, which is going to lead you to feel happy. This next example is a sadder example. It's when you have a negative mind and it leads you to spend a lot of time in bed, which leads you to feel depressed and sad. But the important part to remember is that your circumstances can change. If you work on your thought patterns, it could lead you to have happier, healthier behaviors, which is going to lead you to feel happier and less depressed. You could also change your behaviors by exercising, spending time with people, or doing activities you enjoy. This could lead you to have healthier thought patterns and lead you to be happy. Another element often worked on in CBT therapy is your core beliefs, essentially what you believe about yourself. Your core beliefs can have a big impact on your confidence, self-esteem, and ability to do basic things. Inside, do you feel
angry?
Or content? And is what you feel inside going to have a tremendous impact on the rest of your life? If that is the case, working on your core beliefs can lift a colossal weight off your shoulders and lead to tremendous inner growth. Another aspect you can work on is gratitude. This normally looks like writing a list of things you're grateful for, or trying to focus on what's going well in your life. Anything can be mindful as long as it keeps you in the moment. Examples could include photography, where you're waiting for the perfect moment. You're completely transfixed by your lens, and you wait for the right second to capture the ideal picture you're looking for. Or cooking, where you're trying your very hardest to perfect a recipe for your friends that are about to come over. Or reading, where you become totally engrossed by a story to the point that you forget the outside world even exists. If anything makes you feel mindful or puts you in the flow state, I'd advise you to do more of it. If you lose track of time and it feels pleasant, I'd advise you to do more of that activity because it can have a big impact on your overall life. There's also more structured forms of mindfulness, like mindfulness-based cognitive behavioral therapy, where you learn tools and techniques like how to do a body scan, or how to do a mindful walk. Meet Lucy. She's about to try mindful walking. Her aim is to only focus on what's around her in the current moment. The sounds, the smells, maybe animal wildlife, but she's not allowed to let her mind wander off, and she's certainly not allowed on her phone. If Lucy becomes good at this, she'll be able to control her mind better and rein in her thoughts. Existentialism is a philosophy or therapy modality that can help with depression. My favourite part of existentialism for dealing with depression is the work of Victor Frankl, and I'm going to go through some of his teachings. Victor Frankl was forced to live in Auschwitz, a concentration camp. This was a grim, dark, desolate situation where there was lots of rodents, there was a lack of food, and everybody's families were after being murdered. Every day, him and the other residents would have to lift a large rock from one end of the yard the other end of the yard, back and forth, and the person that finished last was shot dead by the guards. This was a grim, dark situation, but Victor Frankl found that having a sense of humour, helping other people, having a sense of community can really lift people's spirits. But the importance of existentialism for depression is that often people suffering from depression can feel like they're living in a grim, dark, hopeless situation, and that there's no way out and there's no way things can get better. But Viktor Frankl showed that even if things are grim, even if things are dark, you can find joy and meaning within it. It is important to remember that there's hundreds, if not thousands, of approaches for dealing with depression, so don't give up. But if you've tried a few different therapists and a few different approaches and you find that it's not helping and you can't manage your own depression, it might be time to seek out medications. This generally looks like going to your GP to get a referral to a public or private psychiatrist, or finding somebody that really knows about medication within the GP office. For depression, there's an awful lot of types of medication. Antidepressants, antipsychotics, anti-anxiety medication, and they all perform completely differently. A medication expert should be able to walk you through the types of medication, the options of medication for what you're suffering from, the benefits of the medication, what it's trying to do within the brain, any side effects of the medication, long-term consequences of being on the medication, if the medication's addictive. Meds are very complex, but it's very useful to have a good meds expert on your side, because they're going to be able to walk you through everything and put you at ease, and that's why it's very important.